Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo, and we're talking about, every year about this time of year, and it took me a while after moving to Del Norte to catch on that I wasn't getting a cold every year.
Yeah.
After, you go through a week of feeling like you are, but
Right.
not really, and then and then you look at your car and see the dust.
Yeah, dun, dun, dun.
So seasonal allergies, what can you tell us?
Yeah, I was inspired by some of the social media that Amanda put up. Mm-hmm. And especially tears streaming down her face with looking like a classic picture out of a medical textbook.
That's our own Amanda Doctor here at KFUG, who suffered from a serious bout of allergen attack, I guess.
So I thought I'd discuss allergies today. People are asking me a lot of questions. Now, I noticed about last Sunday the green pollen hit my, blue subi. So I think that's when most of the people started developing problems.
Right.
So, allergies can be year-round, but they're usually worse if you're talking about environmental allergies, not specific, things like food allergies or manufactured product allergies. Those are, but environmental allergies way more common in the spring and fall. So you kind of have a pollen surge in the fall, and then, in the spring, but in the fall it starts to become more like molds and stuff.
Okay, sure. As things break down and stuff at the end of the season. That's neat. Okay.
And we become more allergic to things as we age, although children have more documented allergies, probably because there's more people watching them.
Right.
But than elders do. But people oftentimes, when I say, hey, I think this is allergies, they'll say, well, I've never had that before.
And that's a dynamic it's always interesting to me too. Excuse me, is the like you can be around something. Just the more you're around something, it's not that you become even more acclimated to it. You can actually become allergic to it.
And what kills me is that doctors always say, what's new? And they always go to laundry detergent.
Right.
And it's virtually never
really? Is that
laundry detergent. Virtually never, but it's a quick way to get out of the exam room.
Oh, wow.
Without putting a lot of thought
go
into
home and change that, and we'll see how that goes, right? That sort of thing.
But remember, even saying laundry detergent is saying like 10 things. So that's not one thing. And and most laundry detergents are all the same, except for, maybe color or fragrance. But we live in a temperate rainforest, so we have that. Also, that little delight. And for the most part, there's a lot of things out there that we have to be allergic to. Now, allergies are a clinical diagnosis, so you don't really need allergy testing, although people are real interested in it. But if you're an insurance guy, say working for United Healthcare, and somebody has an allergy problem, you know that Claritin, or also known as loratadine, is really cheap and testing is really expensive. So most of the time, people don't really, providers included, insurance companies don't want to pay for it. Providers don't really want to get involved in it, as far as testing. Because the solution almost always is you're going to be on an antihistamine and probably an inhaled steroid of some sort. So, but people are really, really want that. And it probably makes sense.
Want what?
Want allergy testing.
The certainty of it? Yeah, sure.
Yeah, but it's not certain at all. A lot of people who have, classic allergic rhinitis and are quite miserable, even marked, kind of like a reaction like Amanda had, will come up with nothing in their allergy panel.
Really?
And you have to be careful that the right panel is being done. So that's a problem here because we don't really have an allergist in Del Norte County. We do have a practice in Humboldt County that's pretty good, but they're impacted. So a lot of people here go to Medford or go to Reading, and they will do environmental panels relevant to Medford or Reading.
Seriously, really? That's what I was wondering about that when you said that.
Yeah.
So it's going to be a vastly different.
So no useful information there.
I'll be damned. Wow. So. That seems kind of like commonsensical that you wouldn't. Why would you test for something you know where they're coming from? They're coming from a different biome.
They're not paying attention.
Wow, really? That's
Yeah.
just
How many times do I look at somebody's address? Virtually never.
Good point. Good point, I guess. But maybe if you were studying allergies, that might be something that would be higher on your list of triage things. It just seems
maybe. But
Wow.
I mean, my 3 clinics are Klamath, Smith River, and Crescent City, and that's all about the same, biome.
Yeah, exactly.
Pretty much
That's
the
exactly
same
my
thing.
point. But
Yeah.
oh well.
But if somebody lived out in Gasky or
I guess,
Hyuchi,
yeah.
I might make note of that.
Mm-hmm.
But so symptoms are really miserable, not usually deadly. So sneezing.
Wait, hold on. Not usually deadly.
Well, somebody can have an anaphylactic reaction.
Oh,
or
okay,
something.
all right.
Yeah.
Wait a second. Hold on.
So usually sneezing, runny nose and eyes, itching, a lot of itching in the nose, eyes, and then also that tickle in the posterior palate, hard palate, just behind that people, it's a little hard to scratch there. So cough is a common symptom, and usually that's because there's what the the immune system is trying to do is to make all these secretions just all of a sudden start to wash this offending agent away.
Yeah, right.
And so people in Del Norte County, and probably Humboldt too, oftentimes have postnasal drip, right? And we're always kind of snorking it and spitting it and
The cruds.
trying to live with it. Yeah. And so, that drips down the back of the throat and makes a cough worse. Okay, and makes asthma worse. It does run in the family,
Oh wow.
so it's helpful, to ask people that about their family history stuff. Only 30% of adults and 40% of children have it, but this is likely way underdosed. Okay, so it's like getting back to testing. Most insurance companies think it's way cheaper to take loratadine, aka Claritin.
Right.
Doesn't work very well. It is what the local partnership will pay for, but Zyrtec is what allergists recommend. Cetirizine.
Is that an endorsement? Now, is Zyrtec, you can get that over the counter, or is that that is? I've seen commercials for that.
Yeah,
right?
you can totally get it over the
So-
counter.
so
It comes
this-
in
is
a
this-
liquid form too.
Is this an endorsement then, a professional endorsement?
Well, no, because I don't have a financial tie with
Right,
them at
we don't.
all,
Yeah,
but
we don't. They're not
This is
underwriting
a
or anything.
personal
but, a personal
endorsement.
Okay, yeah, there you
Yeah.
go. There you go. Sure.
And the other thing to know about Zyrtec here is that really a 20 for a really highly allergic person, a 20 milligram, which is 2 pills dose is daily, is way more effective.
Wow. Okay.
And if you ask the pharmacy, if you read the box, it says you can only take 10 milligrams a day. If you ask the pharmacist, their head explodes. They're very sensitive about this. They insist on only 10 milligrams a day. If you ask the allergist, they endorse up to 4 a day, so
wow.
40 milligrams a day. And if you ask PADE, we're, at Crescent City UHS, we're all on 20 milligrams a day and have been for years. So there's something about between 10 and 20 that just, it crosses some magic line.
why do they try to cap it at 10 then?
Because that's what the studies were done, and there's no financial incentive to
Sure, I
redo
can see the
studies.
financial. Well, and I can see the
Right.
financial incentive to make sure that that what you're selling is almost just good enough.
Yeah.
But but it just seems like so it's a liability kind of issue then, as far as the
Well, I
study
think the
is outlining?
pharmacists think that, but I think
Okay.
the drug company they just got what they want to work with, and they don't want to put any more money into it.
Yeah. Okay.
Because it's really not about medicine, it's about money. But anyway, so we'll geek out here on half-lives for a minute. So half-life of a drug is the amount of time that takes to go from maximal amount in your system to half.
Right.
Okay. And so 24-hour half-life or duration of therapy, which is a little different, but for Zyrtec and for Claritin, but Benadryl. Now, see, somebody talked about Benadryl in Amanda's, feed. there. Benadryl is good to take if you have an emergent allergic reaction, like you got stung by a bee. That's
Right.
not really what we're talking about, though, because it's
Stung by a
liquid.
tree.
It's liquid. It has this really quick onset of action, but it's got a terrible therapeutic window. So there's something called the Benadryl bounce that I think doctors are aware of, but at least ER doctors are, but most people aren't. So if you feel a certain amount of badness and you take Benadryl and you feel better, your symptoms are better, you might feel tired and worse that way, but your actual presenting symptom is better. Then when you get out to about 4 hours, you're going to be worse symptomatically
really?
than when you started.
Really? Oh, no.
That's called a Benadryl bounce.
Okay.
And it's important if somebody's throat is closing, right?
Yeah.
So, because I have seen actually hive reactions and stuff where people did okay with it initially and then got much worse in about 4 hours.
Oh, my God.
So the reason that Zyrtec and Claritin have been such a step forward is that they're longer duration of action.
Okay.
So Zyrtec is over the counter. There's no insurance that pays for it. The trick right now at the pharmacies is if a provider sends in something that's over the counter, whether somebody's partnership will cover it or not, they pretend that the provider hasn't sent it in, and they tell the patient to go buy it over the counter.
Whoa, that's really helpful.
So then you get one of two things. You get a patient kind of buying stuff that they don't really, it's not necessarily what the provider thinks they're on. It's not being used in the way the provider, and it's not being covered by insurance, although it should be. So, but there's less work at the pharmacy, and they're pretty hectic, and that's kind of...
So you're saying, wait, that's a bad thing?
I think it's a bad thing.
Oh, I was thinking that's a helpful thing.
That is not a helpful thing, because then a patient fires right back to the provider and starts yelling you didn't send it in. And then the provider with tears in their eyes, because they're just trying to help people.
Right.
Notes points out in the computer that it was sent in. And then that angry patient goes back to the pharmacy and goes, well, look at that. They just sent it in. So the whole thing is like...
Yeah, I can
stupid.
see that. I can see that,
It's
sure.
stupid. They do it with pain meds too, constantly.
Wow.
So it gives them more time because they're kind of timed on from the moment they get a prescription in to the moment the patient picks it up.
But that isn't affected by pretending you didn't get one?
Yeah, you didn't get it. You pretend you didn't get it.
And so that's okay. You're not.
Yeah.
It's
so
not,
you're off the hook from an overworked pharmacy tech.
Oh, man.
And this actually wasn't done in this county ever until about 6 months ago. I think a traveling pharmacist came through.
Oh, wow.
And
then it caught on. Wait,
yeah, it caught on like big time. So sometimes in the body of the note or a prescription, when I'm sending electronically, there's a comment section and I write, let's not do this.
Don't go over the counter.
I know this person's stuff is sent. I know that it's, and oftentimes I give people a printout of when it was sent and they present that. But that's a stupid energy burner.
Well, and it also seems like you're just laying yourself out again for liability issues if you ever step in and you're going, okay, I'm going to step in between the doctor and this patient and their relationship and change the course of medication that's been prescribed just because I don't want to take the time, or maybe it's...
But you're not, and it's not a wonderful job. And
I don't mean...
I think they're kind of desperate.
I certainly don't want to be in the position to root against pharmacists, because we've talked on this show often about what they have to go through. But but it just seems like that's a tricky sort of space to inject yourself. I mean, I guess you're already there anyway as a pharmacist, but still to sort of take editorial privilege over somebody's prescription is kind of...
God, it's gotten really bad with prenatal vitamins. We digress, but this is an important digression. They're over the counter now, and I don't know what the composition of that particular vitamin is.
Right.
I don't know that my patient's getting exactly what they need to develop a human being in the right way. And it makes me just so angry.
Yeah, no, I could see that and totally see that.
So,
and there's, I don't know if it's the same with prenatal vitamins as it is with like other quote unquote supplements, in which you can have widely variant degrees of quality of things that go into them.
And providers have the ability to prescribe to a particular disease that they're treating and not necessarily follow the instructions on the box. And so that's, what we see commonly is ibuprofen. So the instructions on the box are like homeopathic doses, you know.
Yeah,
They're
yeah,
teeny,
right.
teeny,
Yeah.
tiny. And I'll say,
because I'm a like, no, 2. I gotta do 2. I'm a big guy.
but 2 is even like lame. 2,
Right,
2
right.
is what you do when you're 7 years old or something, you know. So you
I
big
thought
guy are like 3 to 4.
I thought 2 was like okay, so two would be 400 milligrams, right? Isn't that what?
So ibuprofen over the counter is 200 milligram
Right,
pills.
right.
So 2 is 400.
Very
And a
good.
therapeutic dose for an adult is 600 to 800. So that's 3 to 4.
Okay.
And so people are looking at it in their hand and they're thinking,
This is going to destroy my
I wonder
liver.
if she knows that she's going to kill me with this. And I'm like, and then I have to draw a little graph and we talk about, therapeutic dosing and toxic and then ineffective
Okay,
dosing. And, we have to kind of look at it. And I say, think of those as mini M&Ms.
Oh my God. Okay.
They're not
okay.
really an M&M.
So with ibuprofen, just before we leave that topic, I even try to keep track of how often in the course of a week that I feel that I need to take it. Maybe it's like once or twice if I'm sore
good.
and I'm doing stuff. So yeah, what's too much then? I mean, if I can eat a handful
Too
of
much
them.
ibuprofen for an otherwise healthy adult is more than 800 milligrams 3 times a day.
So 2,400 milligrams?
Is the maximum dose.
Oh my God. Okay.
Although some people take more, and then some people, I don't know if they really take it, but they verbalize that they take it to tell me that they have really tried ibuprofen and it hasn't worked. And I just look at them and say, yeah, you're not going to like kidney failure. If you don't like low back pain, you're not going to like dialysis. So,
Yeah.
so don't do that. So the upper parameter for ibuprofen in an otherwise healthy person with no renal disease issues and no bleeding issues and not on blood thinners, et cetera, is typically 2,400 milligrams
What
in
about
24 hours.
numbers of days in a row?
Some people take it for months, for years.
Yeah, I know people
Yeah.
who do that too, and
I don't think it depends on why they're doing it.
So it's more the high dose, the spike dose, that's the danger than it is, say, chronic ibuprofen in your
no,
system.
both of them have their
Okay.
own peculiarities, I guess.
Okay, but it's
And
not as
Tylenol is way more dangerous if you take too much. So talk to your doctor because that depends on liver functions. and stuff.
right. Okay.
So, but the over-the-counter doses are way lower than therapeutic. So if you took one ibuprofen for a couple of days and your back didn't start getting better, that you haven't really been. You might as well have taken a jelly bean. So anyway, but we digress. So one reason to get testing for allergies is if you are actually going to act on it, and one might be leaving the environment that you're allergic to. So I did have an allergist tell me that I should move to the desert, which is not ever going to happen.
Yeah, right. Who wants to live in the desert? I know
Yeah.
people like that too.
Or pursuing allergy shots, which I still don't really understand because allergy shots seem a little bit like homeopathy to me, which has been discredited. But it's like you give a tiny little amount of what you're allergic to your immune system repeatedly over time. And then in an attempt to kind of like demonstrate friendship between the allergen and the immune system.
You're making it sound like it's witchcraft, but this is basically inoculation, right?
No, it's not.
Why not?
Because inoculation is to stimulate an immune response. This is to dampen an immune response.
Okay.
It's the exact opposite.
Okay.
And I don't know,
get you.
maybe an allergist who has way more education in the field, but to me it seems kind of like nobody ever gets better from it. That's what bugs me.
Okay,
They
okay.
make a lot of money off of it.
Sure.
So
Just
what
like-
other treatment might you have? So intranasal steroids, which are Flonase usually, but there's a bunch of them. Flonase, again, one of the ones that's over the counter. So you send the prescription in that's covered by partnership, but you end up paying a lot of money for it over the counter. Allergen avoidance, which is the whole moving to the desert.
Yeah,
idea.
right. Don't go outside.
Yeah. Oral antihistamines, which, I take daily and have for years. And I'm up to definitely 20 milligrams of cetirizine, which is called Zyrtec. But on some days I've taken 30. So
So you do that every day?
yeah.
Okay.
And then immunotherapy, which was the shots we just talked about. And then, I saw a patient yesterday at Del Norte Community Health Clinic's walk-in clinic. And he was there for allergies, and his request was for a steroid injection. And yeah, some people treat their allergies that way. It's kind of a long-acting steroid that just covers them for the whole allergy season. I personally think that the downside of that is too big to risk.
What's the potential downside?
It's potential. It brings your sugars up, so it makes your pancreas work harder. Also thins bones if you're doing it repeatedly. And, can kind of be like a supporting player with dental disease and stuff like that.
Okay.
But people love it because all of a sudden they feel better.
It's just one shot and you're better, and
they
you don't have
don't
to worry
think about it.
Yeah.
And they don't have to go down and get more Zyrtec or,
Right.
It's just easier. But not very many people get that. And I think there's good reasons not to. Okay. So conservative treatment, there's probably a couple of herbal things that are helpful, like grapeseed extract. There's also frequent house cleaning, especially dusting and vacuuming. But here's the deal. The allergic person is not supposed to be doing that,
Right. So
and it takes about 2 hours after you vacuum for all the allergens to kind of settle down in their nooks and crannies.
That seems like maybe...
And so, say you're a single mom of, a bunch of preteens, they're not going to do it. They're not going to do it in the way that it should be done.
No, of course not.
And let's say the single mom is the allergic person, and I just never see it happen.
But if you have a partner...
No comment.
This might be a way. I mean, and you have allergies.
Here's what it is ideally, okay? Ideally, the allergic person leaves the house. The partner spends 2 or 3 hours cleaning thoroughly.
Right.
And then the allergic person comes back 2 hours after they're done. And when everything's settled down, and they do it weekly. I don't see it happening.
That would be ideal.
That's ideal, guys. Just saying.
I think I'm feeling some allergy. No, it'd be me doing the cleaning. So okay.
No, for you're the cleaner. Lisa is
the breather.
Yeah, the breather. Air purifiers can be helpful. I actually got improvement in mine, my house.
Do you have to like spend to get like a decent air purifier though? I mean, you can't just go get a...
I didn't spend a lot because I have a small house. Okay. So it's probably the one that you go get at Walmart could be up to $120, $140, maybe more now if they're imported from, say, China. So I found it to be actually really helpful.
Okay.
So here's one that I really like: a cleansing rinse before bed.
That actually sounds like a wonderful idea just in general.
Yeah, for sleep, hygiene, all that kind of stuff. But you don't soap up, you don't wash your hair, because we are like little pieces of Velcro, and all the pollen and, random stuff that gets...
Like it's supposed to.
Dander, it gets stuck to us.
That's the plan.
And then so we go to bed and we lie in it for 8 hours. and then it's cumulative. So you're getting your Monday dose again on Tuesday, and then your Monday and Tuesday and Wednesday. And then, so, a kind of a purifying cleansing rinse before bed is super helpful. And it doesn't have to be very long. It's just... like if
just
you were in a chlorine
off.
pool and you wanted to rinse off, just a quick rinse. If you don't wash your hair, because a lot of people wouldn't want to go to bed with wet hair, although I don't care, but it's, if you actually get your hair wet, then you also might be lying in it. So I think it's pretty much neck down. Special bedding and mattress covers for dust mite allergies. We have nasty little looking things that live on us, that live off our skin cells and are really...
I can't help to register the joy that you seem to express when you were saying.
I like the ones that live in your eyelashes too. They're very alarming looking, but it's kind of cool. I like that I have my own microbiome. And then feather allergies, that was pointed out to me recently. I've been around chickens and wild birds my whole life, so I likely have a feather allergy. And when I
Okay.
got rid of my down comforter, I did get better.
Oh, wow.
So,
Okay.
And use hypoallergenic products, so that's stuff that doesn't have, scent in it, and it doesn't have coloring. And that also includes when somebody's doing the little, God, what are those homeopathic scents? They did it at my yoga class and almost killed me.
Right, right.
You
Yeah.
know, like,
yeah.
oh, but it's just a nice eucalyptus smell. Well, it locks down my lungs and
Yeah.
I can't breathe. So, but people who like that kind of stuff just don't believe it's a problem, and so
Yeah.
it's always around. But if you're doing it to yourself, stop doing it. Okay.
There's the Fug House here can be a place
Yeah,
for
you got
scents.
a patchouli thing going on here.
Yeah,
That
I am not a fan.
yeah.
Yeah.
Although I burned sage today at my house. So
Ooh, why?
why? it was a hard week emotionally. So.
That's what I was wondering, if you were
Yeah.
exercising some things more than just like smells and such. But yeah.
Yeah.
Well, good. Does it feel? Did it feel
Oh
freeing?
yeah, it always
lifting?
makes me feel better. So
Good
you
for
can
you.
get 30% out of placebo, and I don't know that I'm doing it right, and I don't claim any cultural competency at all. But I know that UHS, they have saged buildings before, but for what reason I don't know.
Wow. Yeah.
So
Well, if it helps, there's a lot to be said for
Right.
the placebo effect. Very much. It's real, and we should.
Well,
I guess maybe
but
healthcare.
people
should
would
lean
also
into it.
claim there's a spiritual thing that I don't want to be seen as making
True.
fun of.
That's true. Exactly. Yeah.
There's something there I don't understand.
One man's placebo might be the other man's Holy Ghost.
Hard to say.
It's hard to say. Exactly.
Yeah.
It's hard to say.
I don't want to be disrespectful to anybody's scene.
Mm-hmm.
So, but the patchouli in house, I like, really? Patchouli? Yeah. Okay. So, I hope that helps people out there. I think there's some really practical things to do. You don't really need to have allergy testing unless you're willing to consider allergy shots.
Am I wrong to think that other than say Zyrtec, you kind of, maybe it's just the feeling, the vibe you came with today, but it just seems like hokum to you.
No.
Okay, all right.
No,
There's something
intranasal steroids and steroids in general are not at all.
Okay.
It's just hard for me to understand, and it's frustrating. It's also frustrating to tell somebody that, oh, I get that the pollen's out there and you're miserable, and a Z-Pack isn't going to treat your allergies,
Right.
and these are allergies, and no, they're not, but yeah, they are.
Yeah, yeah.
So. It's a hard message, and especially a common one here in the rain. Mm-hmm. So in the fog belt.
I didn't have it so much. Well, it's like the first after moving here decades ago. I remember there being the first couple of years where the crud was pretty much, okay, no, this is something like, and for weeks.
Mm-hmm.
In the spring, and then years it went away and it wasn't a deal,
Yeah.
and then it came back.
Yeah.
And I started getting it. Nowadays, I'll feel like for a couple of days in the springtime, oh, am I getting a cold? Oh, wait, no, it's springtime. I know what's going
Right,
on.
and you feel so terrible, but you go out to Gasky to visit a friend, and it's better.
Yeah,
and then
right.
you cross back into the fog belt about
Yeah.
Hyuchi, and
I'm
you're
home.
like, So, yeah, it's frustrating, but immune systems overall are good things.
Oh, sure,
There's a
yeah.
lot of good that it does for us if it would just calm down.
Yeah, quickly. Yeah, just relax.
Yeah, just chill out, man. So,
Oh man! So I know that we've talked about in a future episode of Health Matters exploring chaplains, the role of chaplains in healthcare.
yeah, I'm super excited about that. So would they have a chaplain, at least as of a couple months ago? There's a chaplain at Sutter, which is something new that I wasn't aware
Wow.
of, and I met him, and he's lovely.
Really?
And,
We're going to try to get him on.
Yeah, I don't know what it is they do, really. I mean, I have this idea they're there for spiritual reasons.
Mm-hmm.
And, when the nuns used to control St. Joe's, they used to leave people little cards saying there was a prayer said for,
Oh, wow.
that particular health. And I think that is healing.
Mm-hmm,
So I'm interested in what this young man brings.
Yeah,
And
that
he's
would be
quite
interesting.
educated,
Cool.
and I want him to speak to that too.
Well, hopefully we can get that
Yeah.
happening before too awful long. Lynn,
Yeah.
thank you very much for this week's Health Matters.
Yeah.